What about when should it be performed? Less definitive data there. The general recommendation today from a variety of expert groups would be somewhere between the age of 35 and 45. And obviously, the later the better from the perspective of the issues of surgical menopause, which is certainly not an insignificant concern, both from the perspective of the loss of estrogen for a woman. As I said, heart disease, risk of heart problems, the risk of osteoporosis, but also from the both the psychosocial, in fact, vaginal dryness, a variety of issues that are very significant, or potentially very significant. They should not be downplayed. And so, somewhere between 35 and 45. The other important point out is that there's increasing evidence now that BRCA1 mutations and BRCA2 mutations are really quite different, both in terms of the lifetime risk of cancer, but in the case of the question I was asked, timing, when those cancers seem to appear. And there's pretty good evidence that although BRCA2 mutations do increase the risk of ovarian cancer, before the age of 50, it's very uncommon. In fact, the percentage of cases of BRCA2 mutations leading to ovarian cancer is before the age of 50 is probably 1% or less. Whereas at age 50, it might be 10%. Women with BRCA1 mutations 10% of them may have developed ovarian cancer by the age of 50. Therefore, it's, again, not unreasonable to suggest that a woman with a known BRCA1 mutation, 35, is a reasonable time to talk about performance of that procedure. And for a woman with a BRCA2 abnormality mutation, perhaps 45 is not an unreasonable recommendation.